All right, so we're going to go through a strength assessment of the lower extremity. And then we'd be doing this style of strength assessment when we're looking for subtle weakness that might be due to a neurological deficit. We will not be doing this type of strength assessment if during function you notice that someone has a profound strength deficit. For example, if someone has a foot drop as they're walking, then we would not be doing this style of strength assessment for the ankle dorsiflexors. We would get the information we need through manual muscle testing. So it's important to know that this is a strength assessment that we're doing when we're looking for subtle weakness. So in order to assess for subtle weakness, we need to make sure that we achieve a break. In some individuals that might take multiple repetitions, but it's really important that we set ourselves up at an advantage and our patients are set up at a disadvantage, so that way we're able to see how strong that muscle is. And the only way to do that is to achieve a break, okay? All right, so the cranial-most muscle that we're going to assess, and this would give us information about the upper lumbar nerve roots, would be the hip flexors. So to put my patient at a disadvantage, we're going to bring him towards end range of hip flexion. And then I'll say, Nick, can you keep your leg in this position? I'm going to try to bring your leg down. Don't let me do that, okay? All right, so hold that position. All right, hold it nice and strong. Don't let me pull. Hold it, hold it, hold it, hold it, hold it. Good. And once my patient's leg starts to move, we're going to stop the assessment, okay? I don't need to move the leg through the entire range of motion. I'll show you an example of what that looks like when we get to the ankle. So to be safe with our patient as we're doing this, we have to make sure that we're not going through the entire range of motion. Once the limb starts to move, the test is done. All right. Next, we're going to go to the quadriceps. All right. So you okay here, Nick? All right. So I'm going to flex the knee fully and then come just out of that position so the quad is still at a disadvantage. All right, and then Nick, try to maintain this position. Don't let me bring your heel closer to your hip, okay? Hold it, hold it, hold it, hold it, hold it. Good, okay? So with that one especially, you might need to do multiple repetitions. So what you can do is count how many repetitions does it take till I achieve a break, and then compare that to the number of repetitions it takes on the opposite side if you're not able to achieve a break on the first try. All right, so the next muscle we're going to assess would be the anterior tibialis. So I'm going to show you guys on Nick's left side just because it's a little bit easier for you to see on the camera. But just like with reflex testing, you would assess one muscle on one side, then assess that exact same muscle on the opposite side. So you compare one side to the next immediately, rather than going through all one side and then all the other. All right, but again, just for the camera, I'm going to show you anterior tibialis on Nick's left side. So we'll bend the near leg so that it's out of the way. And then we'll bring the leg that we're testing just a little bit closer to us. So anterior tib is going to dorsiflex and invert. So Nick, I'm going to ask you to hold that position for me, okay? I'm going to use my forearm to kind of block the lateral lower leg. So that way when I go to push on the foot, he doesn't just externally rotate at the hip, okay? So Nick, you're going to come up and in. And then my elbow is going to be in very close to me, so that way I can move the foot down and away. And I want to be distal on the foot as well, so that I have a long lever to work with. All right, hold that position, Nick. Don't let me move you. Hold it, hold it, hold it, hold it. Good. Once the foot starts to move, the test is done. What we don't want to do, and if you just give up easily here, Nick, okay, is start pushing and then the whole foot moves, okay? We want to make sure we're protecting the soft tissue structures around the joints that we're assessing, and we don't want to use a lot of force through the full range. Once the limb moves, we're done. So the L5 neurological level is going to be the great toe extensors. All right, so we can have our patient with both knees flexed, all right, and then we're going to ask them to extend the great toes. And then I'm going to apply resistance at the same time, left and right here, because we're able to. We don't need so much force to achieve a break at the great toe extensors. All right, so keep those toes up, Nick. Don't let me push them down. Good. Hold it, hold it, hold it, hold it, hold it. Good. And once the toes start to move, the test is done. And then finally, for the S1 neurological level, we're going to test the ankle everters. So I'm going to test the near side. So for dorsiflexion, we test to the opposite side. For the everters, we're going to test the side nearest to us. So Nick, I'm going to ask you to move your foot out towards me. Great. And just like I did for the dorsiflexors, I'm going to block the lower leg with my forearm. Keep my elbow in close. I'm going to hold distally on the foot so that I have a long lever to work with. And Nick, don't let me push the foot inward. So hold it strong. Good. Hold it, hold it, hold it, hold it, hold it. Good. And again, once the foot starts to move, the test is done.